Why does PTSD lead to drug addiction? After experiencing trauma, our brains produce an increased amount of endorphins. Endorphins are chemicals in the brain that help us be happy, and they also help us deal with traumatic experiences to help treat any emotional and physical pain involved. However, in the wake of trauma, the brain starts producing fewer and fewer endorphins, which contributes to feeling depression and anxiety. And some people with PTSD often turn to mood-altering drugs to feel better and compensate for this chemical change. The worst thing about drugs and alcohol is that they're often pretty good at helping us feel good and relaxed, for a while anyways. Alcohol is a depressant drug, and like other drugs, it changes the way we think, we act, and feel when we drink. Other drugs cause our nervous system to release high amounts of dopamine, which is used in our body's reward system. However, the more we drink and/or use drugs, the less effective they become. A person with PTSD is often reminded of their past trauma in their present environments. Their brain reacts to these memories by operating as if those memories are happening in the present. Drugs and alcohol work very similarly. A person's environment can trigger their need to use drugs and drink. Finally, some PTSD symptoms can cause a person to experience emotional outbursts, and these can cause a person with PTSD to feel shamed. They drink more to cope. And eventually addiction ends the same way. A person needs to drink and use drugs just to feel normal. It's also common for a person in active addiction to be secretive about unexplained injuries and accidents like falls from being drunk. Finally, the biggest red flag of addiction are withdrawal symptoms. If you find yourself feeling sick, anxious, depressed, achy, or otherwise off, if you haven't used drugs for a while, you might be experiencing withdrawal symptoms. However, there's one more thing PTSD and addiction have in common. They are both treatable. Treatment for PTSD and addiction at the edge. In my line of work, the combination of PTSD and addiction is called a dual diagnosis. While a complex problem, it's also treatable. Our programs are trauma-informed, meaning that they were designed to meet the needs of survivors of trauma. Our treatment center is a welcoming, warm, safe, and respectful place where the roots of PTSD and addiction can be explored safely and effectively. And if you'd like to learn more about how you can help you or your loved one build a new life, reach out to the Edge Treatment Center today at 844-590-0403. We're always updating our channel with recovery content. Thanks again for watching. See you next time.